Hey y'all, this is Dr. Tasha, and I am back with Dr. Tasha After Dark. Okay. We got a treat for y'all today. Y'all know I don't do very many guests. My guests got to be entertaining. I know what they're talking about. It's just a lot. So y'all know I just like to come to y'all and give y'all the good. But child, today we got to talk, and it's about some stuff that listen. I'm not even an expert at. Okay, so if y'all looked at the previous videos, we done talked about this BBL. I don't know if you know that. We done talked about this BBL, these BBL odors, all this foolishness. And I gotta say, like, where does it extend from? Like, where are we really coming from? What is the aesthetic? So I think a lot of times when we're in relationships, situationships, whatever it is we're in, people's shortcomings, and it's called gaslighting, people's shortcomings, they'll always place on us, right? And so it becomes, I can't get as hard as I would. It's because you're not as desirable as you should be, because maybe your stomach is too big, or maybe your booty's not big enough, or maybe your breasts are sagging a little bit. But is that really it? And I think that we start to feel like, well, if one person feels like that, maybe all of them are going to feel like that. And then we start looking at going to get stuff fixed. Well, in looking at that, and y'all know how I feel about this whole new pick me mentality we have out here for women, and we can get into that as the discussion goes on today. But I wanted to discuss what's really happening in the bedroom. Like, what is really the haps? Is it truly that these men aren't getting erections? And because I've had patients in their 20s who have told me that the man has to stop, leave the bedroom, go watch some porn, and then come back. And I'm like, well, what are we talking about here? Like, I'm like, is your man like 70? And they're like, no, this person is in their 20s or their 30s. And so we have a problem because something is up. And so I'm like, are they bastardizing the porn? Is there a medical issue? What is really happening? Take it to the extreme. I had a male who I do hormone replacement on men who have low testosterone or men who are going through male menopause. And look at my male menopause video if you want to know all about that. Just scroll on back, and I did a whole video on it. But I called to check on him, and he's like, doc, now this person got 2,400 milligrams of testosterone. His testosterone level was 1,100, okay? Which is great, which is where we need you to be. But I said, well, how's everything going down there? Oh, I think about sex all the time. I just can't really get an erection. And then that leads me to believe, well, then we got some medical stuff going on. Because if you think about it, your testosterone is 1,200. You should wake up with a woody. You should go to sleep with a woody. You should have 3-4 woodies in the middle of the day. What is happening? So now we got some medical stuff going on as well. So I needed to bring in somebody to bring this all in, because at the end of the day, y'all know I'm great at what I do, but I specialize in women. Okay. And so I'm starting and talking to women and seeing women, I'm starting to hear a lot of issues that are happening in the bedroom with the men. And they're kind of looking at me like, clue me in, sis. And I'm like, I don't know. And so I needed to get an authority in. Now, if you know me, you know that, and again, we had a conversation in a previous video. I don't focus on Black people. I pay attention to the marginalized communities that don't have access to the information, who are not communicated with in a way that they can understand, that might make sense, that might affect their lives. And also for African American patients, I'll be very clear. If you don't understand the culture, you're not going to have a lot of success treating the patient. You're just not. And so a lot of times I will refer to other African American doctors, but you cannot just be African American. You got to be African American and good. Because to me, if you're just African American, you bastardize the whole thing, because they go in your office, they get bad treatment. Now they're afraid of any other Black doctor. We're not doing that. So I refer to and I communicate with and I work with other African American, any doctor, good doctor, but especially African American doctors who are amazing at what they do. And we are blessed to have one here today. This is my homie, my friend, my colleague. You've probably seen me on his podcast. This is his first time here. We are delighted to have him. And if you are my patient, 9 times out of 10, you have been to see him. Okay, this is Dr. Dave Montgomery. Dr. Dave owns the Prevent Clinic. It is in Sandy Springs here in Georgia. He is a cardiologist affiliated with Piedmont Hospital. He is the man.com. He's like, I tell my patients, he's like the male version of me because he's going to listen. He knows what he's doing and he's fly. I'm just saying. Okay. So that's really what I tell my patients.
That last part. Let me write this down.
And he is amazing and super easy to talk to. So a lot of times I even send my patients' husbands to see Dr. Dave if they may have issues. So thank you so much for being here today, Dr. Dave. Welcome.
You know how long I've been wanting to do this? We finally got it together.
Because this man, when I tell you this man is busy and he lets no grass grow under his feet, I got to learn something from him. I'm always working at this company, that company. He's like, me and Sarita are away this weekend. Me and the fam going. He does not play. Yeah. And I can appreciate that because he works very hard. But thank you so much for coming, Dr. Dave.
I'm excited to be here. I'm excited to dive in with your people.
Yes.
Have them come over and be my people too.
Yes. You know how we do.
So absolutely. Yeah. Let's get into it.
Okay, Doc. So let's get into it. And like I said, I deal from the female perspective. Yeah. But you know that women are problem solvers. So when there's stuff that's happening in the bedroom, they come where they're comfortable and they come to say, help me solve this. But it may not be anything that they need to solve.
Right.
So from a male perspective, let's talk about it. We have men who are having issues in their 20s, right, not being able to sustain sexually. And somebody says, well, why do you have a cardiologist here talking about sexual dysfunction? We're going to get into that, okay? Mm-hmm. But I want to take it all the way up. So, Doc, I'm going to let you jump in and just do your thing and talk to us about, one, why you're here as a cardiologist talking about sexual dysfunction, and in kind of each age group, what we should be looking for, and how we can help these men.
No, I love the stories that you told. I just want to highlight the 20-year-old and just add a little point that's not necessarily cardiology, but I'm still a doctor.
Right.
So a 20-year-old in that story that you told that would have to stop, excuse himself,
right,
to watch porn to come back, that's a relational issue. That means that my mechanism works, it just doesn't work with you.
Ooh.
Now, damn. And that's not a gaslight. You have to be thinking about that. And sometimes that direct message to somebody can hurt your feelings, right, but it's better
to say it
than hiding it.
Right.
If he goes off and he comes back, erect and ready to go, he doesn't have he doesn't have a physiologic problem.
Gotcha.
There is either a relational problem, there is a psychological issue that gets uncovered, or whatever it is. It could just be that kind of dynamic. However, if the 20-year-old is having trouble even in different scenarios with different people, with himself, right? So not being able to actually successfully masturbate. Then we start thinking, if he's not having that, right? Then we start thinking of physiologic mechanisms, like maybe there is something going on. So that's just that kind of basket. And,
gotcha.
And there is a such thing as a 25, 26-year-old who has had systemic diseases like hypertension for a really long time because it's a gene in the family. And hypertension is one of the main reasons why my young men can't really have good erections and the way that they want. So it could be that. And I guess the bottom line, just to bookend that, is go and have a conversation with a doctor you trust. I say that all the time.
Yeah.
Which means that you've got to go do something, which is go out and find who that is. I always say wives save lives, and even if you're not a wife, if you're in that wife figure or you're auditioning for the wife, it might be you that takes the 26-year-old
right
to make sure that he gets checked. Okay, so that's that piece.
Okay. Whew.
You've
So
heard,
for all of y'all, sorry, Doc,
Yeah.
that might, y'all in the middle of the classroom in the back, basically he was saying that, his tool is okay. You either trigger him or you just don't do it for him or whatever the case may be. Y'all just might want to talk about that. But it is not a health issue for the most part. It could be, but 9 times out of 10 it's not. You just ain't his flav, sis. And sometimes it's just to be like, okay, you're not my person, and go on and move on.
Yeah.
Go on and you don't need a BBL, you need a new man.
Right.
All right.
Well, but, and it could just be something that you got to talk about.
Something you got to
Like,
talk about.
I don't like when you do that. Every time you
Y'all
do
might
this,
smell funny.
Right. It could be smell. It could be, right? If every time you do this one thing, boom, that turns me off.
Yeah.
And guess what? There's a generational difference in the way that we communicate. Some people don't want to even talk about it. I just want to do it. If you happen to guess what it is, you figure it out, great. But that's for adolescents. That's for kids. That's not for adults.
Right.
And I think it deserves a conversation. But you got to be willing to have your
Have
feelings
that
hurt a
talk.
little bit.
Yeah.
And I think that's okay. You've heard me say this multiple times, that a man who has erectile dysfunction has heart disease until proven otherwise.
Yes. Let me say that again. Let me say that again, because this is why Doc is here. A man who has an erectile dysfunction and can't get it up, can't keep it up, won't get as hard as it needs to be, he has heart disease until proven otherwise.
Yeah. And we use heart disease kind of globally to talk about the blood vessels. So it's really vascular disease, if I can be wonky. But remember, the same problems that cause blockages in your heart arteries is going to cause blockage in
Everywhere
any
else.
of the arteries.
Yeah.
Right? An insult to blood flow anywhere is the same insult to blood flow everywhere.
Wow.
Anywhere that there is a blood flow. As we know, the erection, both for men and women, by the way, but for men, since we're talking about it, is a vascular phenomenon. That means if the blood vessels are not working, it's not going to work. And the blood vessels have to dilate and they have to stay engorged. There's a mechanism in place for it. If your blood vessels don't work because your blood pressure has been high for a decade and you've refused to treat it, or you don't even know that it's high because you haven't gone to a doctor for various reasons, you can have erectile dysfunction. Blood pressure is one of the primary reasons for certain subpopulations, particularly African Americans, to have heart disease. Blood cholesterol. Listen, you can't feel your cholesterol. Like, you can sit there and you can read all you want to, but until the AI agent is able to look in your eyeball and tell you what your cholesterol is, you've got to go get it checked. So your cholesterol could be super high and you could feel amazing. You could look like the picture of health. You could be working out at Lifetime, this time, everybody's time. Every day, 7 days a week. Like, literally, when you walk in the door, everybody looks at you, but your cholesterol can be sky high. And you won't know it. So you got to go get it checked. The third one is blood sugar. We talk about the big three: blood pressure, blood cholesterol, and blood sugar. So blood sugar can be high, and you very often will have some signs and some symptoms, but you might just put that thing off to the back. Like, why is a 35-year-old getting up to pee that many times at night?
Right.
It could be a number of things, but it could be your blood sugar, especially if you just ate fried this, French fries, eating like you're 20 still, right? And it could be your blood sugar. Those three things, if you let them go long enough and you let them go and they're abnormal, let's just stop for a second. Who wants stuff to be abnormal? Nobody.
True.
If it's abnormal, how long do you think your body is going to just let you rock like that before it
shuts down? It's just like, come on, girl. Come on, boy. Get it together.
Come on.
Yeah.
So there are grown folks that go to the doctor. They actually go. And they know what the problem is. It's one of those big three.
Right. And they cool.
And they will tell you, listen, I'm not doing it. Not only do I not want your medicine, because some of them come in the door.
Oh, straight up.
Telling me,
I'm a minimalist. I don't do medicine.
Right. And then
I'm a naturalist.
I'm a naturalist.
I want
it all natural.
Oh, okay.
And then they'll leave your office and go to the Joe's, Moe's, and the fried chicken spot.
Oh, yeah. As I tell them, I said, oh, yeah, you can do it as natural as you like. We're gonna stay natural. Yeah. And then when you end up on dialysis, you're going to need 14 medicines to keep you alive. I'll wait.
Yeah. But, I'm commercial break on this one, right? Because the commercial break is, I understand why people feel like that. So, we've heard of Maslow's hierarchy of needs, right? This guy we're talking about. Humans, actually, you can't get somebody who is poor to start thinking about cleaning up the environment when they're just trying to find their next meal.
True.
So at the very bottom of this is humans have to be fed.
Right.
If you're hungry, you're not thinking about anything else. Right?
That's true.
Because when people get hangry, they're not nice. Okay.
They just want to
Imagine
eat.
being chronically hungry, like underfed. You're not thinking about how you look, if there's trash in your community. You're not thinking about some other person. You're thinking about, where am I going to eat? The next one is housing, feeling safe. One after that is self-esteem. At the very top is self-actualization. I want to do it myself. If I got to depend on somebody else or something else, I feel that's not right. And that's every human being, irrespective of your race, how much money you got, who your mama is, what country you're from.
Really?
The hierarchy of needs. So when I get a 50-year-old, just like if I get a 30-year-old or a 70-year-old, they come into my office. And if I'm going to talk about some medicine, I got to make a case. I have to make a case. So part of my job is making a case of why you really should consider taking this medicine, because I got to fight against Maslow's hierarchy.
You know what? And I want to ask you, how effective do you think this is? So, as a gynecologist, yes, obviously we check blood pressure, right? And we get their blood pressure when they come in the office. Do you know what I've found to be very successful? Like when I educate them about blood pressure. And I tell them, I said, they always put a bunch of shitty doctors in the middle of a black neighborhood. And they convince you that your blood pressure is high because you eat pork, you eat salt, and you're fat. I said, but what if I told you it's genetic? Your mama got it, your daddy got it, you gonna have it. The only thing you can control is how fast you get it and how bad you get it. That's all you can control. But you can't control anything else. And I'm like, why do you think they got a dialysis clinic in the hood everywhere you go? Because everybody thinks like you. I'm going to lose the weight. I'm going to stop eating pork. I'm going to stop eating salt. They have convinced you that bad behavior got you here, so good behavior is going to get you out of it. And it's not. Now, you want to take your, red yeast rice or oil of oregano for your blood pressure. I don't have no problems with that, but here's what we're going to do. Because what we don't want to do is kill your kidneys. And, when I take the fault away from them, they hear me.
That's right.
They hear me.
Right.
When I truly explain
around, it's not your fault necessarily.
Right. That's why I'm like, it's
sometimes
not you.
It is, but not necessarily.
When you 463, I did have somebody come in 463. Baby, we got so much to uncover before we can even.
Yes.
But the point is that when I make it like, no, this was going to happen regardless.
Right.
We just get to determine the outcome.
Yeah.
And where we are, but it was going to happen regardless.
Yeah.
When they get that picture, then they're like, okay.
Because then they think about, on mom's side, all of my cousins,
and that's what they
aunts
say.
And uncles,
everybody has it on my mom's side.
And this one had his toe chopped off. This one's on dialysis. This one had a stroke. And you start to make them see, but that you have an opportunity to change it, have that same plight.
So again, the empowerment is yours again.
There it is.
But I take away they feel powerless in that I did this to myself. And I don't know if I'm ready to change yet, because I do still like that. And I'll be like, now, you want to come to me. And I tell them, I still like to do what I do.
Drinks.
Right. Yeah. And one thing I tell them, I said, you can come into my office and tell me you're a minimalist, because I can respect that. And that basically says, give me the minimum amount of everything that's going to maintain my health. But don't come in and tell me you're a naturalist. And then I say, what you had for dinner last night, and you had Chick-fil-A, because you can go to hell. You can go to hell, because everything you don't want me to do for you, Chick-fil-A did for you in that one bag that they gave you.
Yeah, just one meal. So I mean, there's so much there. I think just having people be as objective as possible. Measure your own blood pressure.
That's what I tell them.
Go and look. And if we know that there's certain foods that are going to make your blood pressure high, I want you to go and read it before you eat it. So go to the nutrition facts. Every last fast food, casual dining, they have to publish the information.
What it is.
In some states, they have to have it right in the stores, right? So I think New York has something like that, if I'm not mistaken. But with that being said, I have them do it right in my office. That's why my office visits go 15, 20 minutes longer than everybody.
45 minutes,
because I will pull up right in the office. No, don't take my word for it.
No, exactly. Let's pull it up.
So then when you see that one chicken sandwich, one burger, one bowl, they might have you think that, the casual dining ones that do these bowls and stuff like that are overall better, and they may be in certain areas. For example, a burrito bowl may have less calories, but how much sodium does it have? And so for somebody who is not have a calorie problem, less calories is not for
They
you.
ain't got a weight problem, but they got a hypertension
That's right.
problem. You
And
can't
just
have that.
because it's generally healthy doesn't mean it's for you. That's the other thing. Just because it's natural doesn't mean it's for you.
Exactly.
Don't get me started, but go and read it, right? So pull up the burrito bowl, and what you'll find is
Scary.
that sodium is rampant. It will blow your mind.
2,000. Oh, yeah.
Yeah.
Oh, yeah.
So let's give them one little piece of fact that I want everybody to know. Most communities, most people should have a dietary daily sodium intake of less than 2,000. People who are at risk should have it at 1,500. There's some of these meals that are 1,600 per meal. We found one, a chicken place who has not even a full meal. One of them is 1,600 milligrams of sodium. You haven't even had a French fry. You haven't even had a side. You haven't even had whatever else you drink with that. And so just by and large, I will blanket statement say, don't eat fast and casual dining to my patients who are.
Yeah.
And I put that big zero on there. They probably showed you the pictures that we take. I say, take a picture of this board because I have a board.
Oh, no, they won't show me.
I'm writing this on the board. And I'll have zero. And all the things I want them to have none of, it will have fast, process. It's up there. Don't pull into a drive-through if you're battling with uncontrolled hypertension, because the end result of that is, we can talk about the heart attack and stroke if you want to, but what we are not talking about is your erections.
There you go.
Right now, here's the kicker. I want everybody to tune in to this. It's not just men's erections.
Boom! Now I'm about to gain something right now, y'all. Okay. I'm about to gain something.
If you think for 1 minute that high blood pressure that results in the arteries get all stiff and chalky and non-compliant doesn't result in changes in the female arousal state and sexual function,
y'all jacking up y'all clitoris.
The clitoris is the female counterpart to the penis.
Right.
But for size and a tube that goes through the middle of it, okay, it functions pretty much the same. The blood supply is the same, comes from the same place, and it does the same thing. It is a really acutely sensitive area, a bunch of nerves on the end of it, and it's got a lot of blood flow. If the clitoris doesn't engorge, you're going to have less sexual arousal. It's not going to be as good. If the vagina itself, internal, external structures don't engorge with blood, lubrication is different. It's going to feel that you can have pain, and you just are not going to enjoy it as much.
Right.
So my females, we don't talk about it as much, which is bullshit. Excuse my language.
It's true.
Right? That we don't talk about, hey, listen, get your blood pressure under control because I want your sexual function to be, your sexual health to be as high as possible. We don't say that. And I will admit, even I don't say that to my women. And that's just a societal problem. That's you see?
I got another thing to come at y'all sideways about, so now y'all know.
Yeah, you see what I'm saying?
Yes.
But the studies are showing, and there's not that many studies.
Oh,
so you're
never
not about
is.
to go Google and it's going
Never
to be like,
is.
just a whole bunch for men now.
Of course.
Erectile dysfunction,
Of
blood pressure.
course.
Oh, it's like,
because I was today years old when you're telling. It makes perfect medical sense.
Absolutely.
It makes perfect medical sense because I always tell them common sense is different than medical sense. That's my big thing. But that makes perfect medical sense. And I was today years old. Yeah. Never even thought about it.
If you are 30 years old, ovaries are intact. You don't have any reason to have an estrogen deficit, and you don't have PCOS. Right? There's some complicated things in a 30-year-old, right? But if you don't have any of that, and you're starting to have, why is it changing? Something's going on. And if you are one of those hypertensive that goes to her doctor, and the doctor is saying to you, I really want you to work on this blood pressure. I don't want to put you on medicine, but you got to work. And your blood pressure is consistently 140 over 90, 150 at times. And you keep telling him or her, your doctor, I don't want to be on medicine. Please don't put me on medicine.
They're not doing you no favors.
It's not doing you any
They're not doing you any.
favors.
That drives me crazy.
Right? So I'm talking about short-term things. Fertility, just enjoyment. Forget about fertility. Just enjoyment goes down.
Wow.
Okay? It makes sense. All of the big three that make a man have erectile dysfunction, blood sugar, blood pressure, blood cholesterol, will make a woman have sexual dysfunction. Female sexual dysfunction.
Wow.
Yeah. Go get this stuff checked, and if it's abnormal, have a plan to make it normal.
Wow.
We don't
Mind blown.
Yeah.
Okay, because I'm learning with y'all today. Like, wow, this is a whole situation. Wow. Okay. I never thought about that. I mean, a lot of times when I see women in their 30s, obviously I check for thyroid, talk about it, talk about dehydration and where we are with this. And I'm like, hey, listen, the clitoris listens to your subconscious mind. So what do we have
Yes.
really going on? What's in the
That's right.
bottom? Have you seen him liking somebody's pictures? You know about something going on. You just haven't spoke
That's
on it.
amazing. Yeah.
Y'all, they up on Facebook acting
Yeah.
a fool and you feeling, is he not bringing money in the house? Are you just busy, tired? And I go through those things with my patients, but obviously, how I am when they have elevated blood pressures, they're not being addressed. You're seeing a doctor about it and it's still elevated. I send them over to you. When have you had an assessment?
Yeah.
Because I feel like a lot of times don't rush my patients through. Well, they did an EKG. EKG ain't gonna tell me shit.
Right.
EKG gonna tell me what's going on right here, right at this second, or if you got some long lasting forever damage, which you should know about at this point.
Right.
But what's your heart look like? Have you had a stress test? Are your vessels clogged?
Yeah.
And as an African American woman who's overweight and hypertensive, tell me why you haven't seen a cardiologist yet.
Right.
And I'm like, you got insurance. Like, what are we doing?
Yeah. Yeah.
So, people buy the drones. Here you go, doc. Here you go, doc. I'd rather address it than not address it.
Yeah.
But seriously, never even thought about that having any type
That
of
acute impact.
that
We know the chronic
right
impact
this
right
second.
now. And you can't figure it out. So, just a sidebar, so women who are seeking to become pregnant.
Right.
We now know that both parents have to be as healthy as
Yeah,
they can be.
yeah.
Gone are the days they'd be like, oh yeah, it's all, we don't even call pregnancy loss miscarriage anymore because the word miscarriage says that it is only on the woman. It's not.
It's not.
Because if the male
is overweight,
is drinking whiskey every night, smoking cigars,
hookah too,
all of it.
Hookah will change the DNA of semen, of sperm.
Get out.
Hookah changes the DNA of sperm.
You can't be changing the DNA of sperm.
You understand what I'm trying to say?
So quality.
Yes.
See, so some of my guys and gals now think that when I take away the cigars and I put on that zero, I told you don't do this, smoking anything, include marijuana is on there. They don't realize that piece right there.
Yeah. Yeah.
They don't realize that it can have a direct impact. You gonna let a hookah change your seed?
DNA.
Wow,
literally.
That's big, Doc.
Literally. And I mean, even it's so funny because you know why in our community we're starting to see a lot of anti-vaxxers? Because they feel like vaccinations have increased our rates of autism in our community. But do you know what actually has increased the rates of autism in the African American community? Obesity. If the father of the baby, not the mother, if the mother of the baby is obese, and we deal with a lot of miscarriage and a lot of issues, but if the father of the baby is obese, there's a 50% increased risk of the baby having autism.
Yeah. Yeah. There you go.
So,
that direct impact that
correct.
dad has
Now
to
remember,
that's right.
back in the day, black men, they were very much more physical with their jobs.
Yeah.
They were construction
That's the only
workers, they
job
were
you had.
builders, they were
Yeah.
on the railroads, that's
Yeah.
all we had.
Yeah.
Now we're very much more educated or lazy, however you want to put it, and we're not getting the physical activity and
Yeah.
we're not working every day.
Yeah.
And the obesity rates, 85% of black people are obese.
Yeah.
And so the obesity rates are raising, and that's why the
And it's
autism
having a
rates are
direct
raising.
impact
Right.
on our offspring. That's
Exactly.
a generational health impact. People talk about
Exactly.
generational wealth. Well, you can't enjoy generational wealth without
generational health. Exactly.
So it really has to be, for mine. But to your point, I think this should be underscored. If you are about to conceive, you are family planning, mommy and daddy sit down and chart out a plan to be the healthiest human being you can be before you go and do it. Because all of the things that you're talking about can have some impact. Whether it's indirect or go and get the belly down. And check this out. Even your success rate as a man, if you let the gut get too out of control, here's what we know about the fat that's inside the muscle wall. So we're not talking about the stuff on the outside. because I'm 52, and this man, I'm like, if I can't get rid of this stuff, anyway. But also we fight the stuff that's underneath the muscle wall. We call it visceral
the visceral fat.
Okay? So the visceral fat is very toxic. It's always very active. There was a time where physicians, scientists didn't think that fat was really more than just just inert, just sitting there.
Right.
It's very active. It secretes all kinds of stuff.
Right.
Here's what also happens in the fat. You have a very funky enzyme called aromatase. This is up your alley.
Yes.
Aromatase is not your friend if you're a man or a woman, depending, right? PCOS, for example. But it's not your friend if you're a man and you make more aromatase. Aromatase changes your testosterone into estrogens. Now, when you start developing secondary female sexual characteristics, by that I mean breasts, breast tissue.
Yes.
You start losing hair, your member shrinks, your voice changes, all that stuff. But like those are signs that your estrogen level is high. Now, if you are 40 and that's happening, because there's a lot of 40-year-old obese men who have visceral obesity, that is happening until somebody proves it otherwise. So if you're thinking, okay, we're having a hard time, being pregnant, typically the woman is going into fertility clinics and undergoing shots and all that. While she's undergoing shots, hear me out. You should be undergoing a medical evaluation and going to the trainer and the dietitian immediately, because your goal should be to lose 20% of your body weight before you conceive. And if, as you're doing it, you're going to see, my erections are better. Like it's not irreversible.
Right.
It's not like, the testosterone's gone
you
and
can
then you're
fix
screwed.
it. Right.
It can actually be changed
right.
now. And then also to your point, sometimes it's a testosterone replacement therapy that is right for you. You got to go talk to a doctor before you know.
Right.
But it's big because we're not thinking about that. We're like, I don't want to hear about that, heart attack.
I ain't
stroke.
finna lose no weight. Right.
People generally don't think it's going to happen to them. Listen, there's not going to be that many people listening. They'll be like, oh yeah, I've never heard of that before.
Right.
Maybe one or two things.
Right.
But many people are going to know that if your blood sugar, blood pressure, blood cholesterol, see, so everybody's watching us, they're going to be able to say the big three are blood pressure, blood sugar, blood cholesterol.
Right.
I already know.
Right.
I'm going to make sure those are really good. I know that those turn into heart attack and stroke. But I did not know that they affect my sexual function,
male or female.
Yeah.
That's crazy.
Yeah.
You see how we just be breaking it down over here? You see what we do over here? So, again, I'm a forever student. So I'm learning with you guys as well. And I talk to Dr. Dave all the time. I send patients to him all the time. And this was something that, we kind of just, our bridges just crossed on this one because, it makes sense, but I just did not know, right? So I pulled up something. I don't know if you guys know what this is. I don't know if this is the actual factual, whatever. So these are some poppers or something, whatever. I know they sell them at the gas station. They have different kinds at the gas station. They're honey poppers. Some of them look like actual packets of honey. So I said to Dr. Dave, obviously we know that they work, right? Because a lot of people use them. Apparently they for sale outside the club. They at the racetrack or wherever you get your gas. They might even be in the bathroom. You know how the people be selling this stuff in the bathroom at the club. They still do that. The people, the attendants,
the
hairspray, all that. Okay, so they still do that. So apparently they sell.
I don't know if they do it because I don't.
He like, I don't know. I don't go to the club. Okay, so so apparently they still do, and those things are for sale. So I asked Doc, like, what is this? Is this okay? What is going on? So, he did the doctor thing and said, let me look at this thing up and see what's going on and see what the deal is with all the. So y'all want to know, and to my understanding, women are also taking the honey popper thingies.
Such a great point.
Yes.
Finish that point.
So
the women are taking them too.
And
they're feeling like their sexual arousal is better.
Correct.
The actual experience is better.
Yes.
Do you know why?
Why?
So we looked at this. Okay, so it happens to, so at least that one, the honey one, okay, is on the FDA website. And there it is. It's on the FDA website, and they do have a warning because it does contain the main ingredient of Viagra, sildenafil.
Sildenafil.
So sildenafil is just a substance that makes blood vessels open up to their maximum.
Okay.
So remember we said that erection for men and erection for women, sexual arousal for women, that whole process is a vascular process. The more that the vessels can engorge, the better the erection, the
Gotcha.
better the
Gotcha.
erection.
So it makes sense.
So now we got sildenafil. So you say, well, when a woman takes that and she's got heightened arousal and orgasm and all this other stuff,
Right.
it's because
Of
maybe
the vasculature to the
there
clitoris.
There it is.
Yeah, I see
And there's
this
at least-
medical sense.
There it is. And there's probably a little bit of, there's not a ton of research around the PDE inhibitors, kind of get wonky with people, but we call that class PDEs, but sildenafil in women, there is a little bit out there. It's just not enough for us to say, okay, women
we
who are
gonna
having,
prescribe it for women.
decreased lubrication, decreased, dyspareunia, painful sexual,
Sex.
that we should do it. It hasn't been studied, but we know why, right? So it kind of makes sense. But if you got high blood pressure, high blood sugar, high blood cholesterol, and you take that,
You going down. You going down.
I just don't.
We don't know how safe it is.
You gotta go talk to your doctor.
Yeah,
I know
'cause
that
you
sounds
know-
like a public service.
No, but I mean, it's true because, we all know before they can get Viagra and Cialis, they got to run through their blood pressure list. Sometimes the medications got to be switched.
Yeah.
This can cross with this. It ain't worth going down. And then if you like to bust it down and really, and some people do the what do you call this? The Viagra and the cocaine. Who was the guy who died?
What?
Yeah, the guy who died. What was his name? Kevin Samuels.
Oh, did he?
He
is
was
that
on
when
the
he died?
cocktail and was with a nurse
no,
at Grady at the time.
When he died, he was having.
He was having sex, and it was. I think she was at Grady. I think she was a nurse at Grady. They ain't looking at me, but
Okay, so
he was on the cocktail of the Viagra and cocaine.
See the autopsy report.
Yeah.
Because it is likely that he had
A heart attack.
underlying heart disease before
probably.
taking that stuff. But the point that you're making is right. If you don't know you don't have heart disease,
Exactly.
don't take this stuff.
That's the point.
Because just because it's over the counter
Don't think
doesn't
that
mean it's
is
for you.
And then they'll say organic,
Yes.
natural, vegan,
Non-GMO.
non-GMO. Y'all do realize cocaine is organic, natural, non-GMO. Y'all do realize that, right? And I'm not judging cocaine by any. That's what you do. We don't judge over
Right.
here. It's your business.
Yeah.
But case in point, because something is natural, organic, and non-GMO still does not mean it's a good idea for you.
No, hell,
So let's be clear.
cyanide is non-GMO.
Well, yeah, I mean,
strychnine is natural.
Damn.
We're not going to
Well-
be so, things just because it has a natural
Natural.
label doesn't mean.
And that's what people get. They get so
Yeah, no,
wrapped.
they-
Oh, this is natural. Let
Yeah,
me take
no,
some of the. Hold on, sis.
Let's
Hold on.
take the strychnine right here.
Yeah.
No, I'm
Right.
not
Take
taking
the
that.
poison.
If it's
natural.
not good for me, don't take it. But
There
the
we go.
only way for you to know what's not good for you, doc, is you got to go get checked.
You gotta get checked. I wish that I could kind of, and a lot of times a lot of people have been through traumatic experiences with doctors.
Oh yeah.
Or it's either one of two things. And I don't know, let me know in the comments where y'all fall, because it's either going to be somebody who has had a traumatic experience or somebody who does not want to take medicine and they feel like the doctor's going to tell them
Yes.
to take medicine.
That's right. That
Right?
hierarchy. Yes.
That
Yeah.
and I implore you to, now you come into my office, you're not going to tell me what I'm going to do. Like, let's be clear, but I feel like we can work as a team. And that is for me saying, I understand that you're a minimalist. I'm a minimalist as well. Why? Because I don't want to have a bunch of medications to refill, because that's more work for me. If you don't need them, you don't get them.
Right.
Right? So that's good medicine. You should only be taking what you need.
Yeah.
But you should also be able to have a family member, a teammate, to say, okay, let's work with this.
Yeah.
What are our goals? We always figure out what your goals are, and then you can figure out everything along the way.
That's right.
And it should be somebody who has the time to talk to you, the time to figure out where we at with this thing and what is preventing you from doing what you need to do, and have them work with you. Now, I had a patient, and thank God I have a bit of patience, and I do talk to people. She refused to get an HIV test. And I said, okay. Now, again, I speak for one of the companies. I do so much for HIV prevention. I'm all about PrEP and PEP and everything else. And so I was fuming a little bit on the inside, but I was like, if something's triggered me this much, then it's a reason behind it, right? And so I said to her, I was like, well, you don't have to have one. First of all, we can talk about it, but because you checked no on your application, she was new. I said, I don't care what we talk about. Even if you change your mind, I'm still not doing it. You can come back in at any time. If you're a patient in this practice, you can always get blood drawn. You don't even need an appointment. Just come and say, I want this. Just pop in and get it. So at this point, if you want it done, you can pop in at any time. But because you said no today, it's no. We don't bully people here. But out of curiosity, why don't you want it done? So after talking and talking and talking, she was still under the impression, as we had done in like the 90s, early 2000s, that whenever she got her HIV test, the results wouldn't be back for like 2 weeks. And she's like, my anxiety won't allow me to be stable for 2 weeks. I will nut up. And I was able to say, okay, well, let's do this. I said, first of all, HIV tests come back in 24 hours. She's like, what? I said 24 hours. I said, and so let's not get it at the end of the week, because it was like a Thursday, my last day in the office. I said, let's not do that. I said, let's get our testing in the beginning of the week. Monday, Tuesday, Wednesday. The results will be back in 24 hours.
Absolutely.
And we'll go from there.
Right.
I said, but when you're ready.
Yeah.
When you're ready.
But she heard you.
And she heard me, and she came back Monday. She got all of her testing done, and we were in good shape. So she had all the testing done. She was okay with doing the testing. She just didn't want to do the HIV because she didn't want to live 2 weeks in craziness.
Always something like that.
Correct.
Here's the problem. Most physicians get their ego all tied up in it.
There we go.
And that's lived experience.
Yes.
That's, depending on who you're talking to, you might have a different stance with a man or a woman or black or white, or that. All of that is real.
Yep.
I'm not dissuading you. But behind every person who walks in the door, for example, who knows their cholesterol is high and they walk in the door and tell me they're not on statins, give them a moment to tell you why.
Exactly.
And sometimes it just requires them to say it out loud because they never have.
Yep.
They've never talked to anybody about the reason why they don't want to take a statin is because their great aunt, whom they loved, they put her on a statin after her stroke, and she died a week later.
Right.
And they attach her
death to that medication.
As opposed to the natural process of the stroke.
Exactly.
Now, it's not my job to undo that for them, but sometimes it just takes them saying it out loud to realize what's going on.
Yep.
That traumatic experience thing is woven into the fabric of many black people in this country.
Correct.
And it comes down from real people and real lived experience where there were experiments done. There were, and I disagree with a colleague who says, hey, listen, Tuskegee was decades ago. Yes, it was. But if I walk into an emergency room right now, somebody is getting disparate care because of the way they look. So I get it and I understand it. And if we will just embrace it, that's occurring, then we can get past it.
And that's when I say you have to understand our culture in order to successfully treat black people, this is what I mean.
That's right.
Yes, Tuskegee was a while ago, but if you understand our culture, we pollinate.
That's right.
So generational things have been brought down.
That's right.
And we have been taught not to trust certain things, not to do certain things.
That's right.
But then again, medicine perpetuates things because as a black female, if you walk into the emergency room and you have pelvic pain, you're getting treated for STDs. You're getting a shot, you're getting a couple of pills, they're going to do an ultrasound, they're going to check for STDs, they're going to tell you, oh, you have a cyst on your ovaries, because every woman does, because you ovulate. They might find a fibroid or two, and they're going to say, go to your gynecologist, but they're going to treat you for STDs before you leave. It's just ingrained, and it's what we do. And again, when it comes to us, the reality of the situation is, I feel like it's lack of education too.
Yeah.
Just you have to, because that's where common sense and medical sense don't always align, but our culture makes it align.
Yeah.
You get what I'm saying? So the common sense would be, she's been on this medicine for a week and she died.
Right.
No, but she was dying the whole time. That medicine was a last ditch effort to potentially help.
Yeah.
If she had a longer prognosis.
Yeah, no, but it's not everybody else's. It's not the general public's job to fix that. We have earned the reputation as a group of professionals, although you and I weren't there when all this stuff was happening.
Right.
To not be trusted because of the way that we've handled ourselves. And until we decide that it is our responsibility to atone, like literally have this in the back of our minds. And we talked about this on the
We
on
talked
the
about this on your
podcast
show. I remember
with
that.
with Dr. Drew, right?
Yeah.
So Drew was kind of saying that, and I was really encouraged by it coming from him. You know, this idea that listen, there were people who were experimenting on, and it wasn't just Tuskegee. It was, you know, we just
Years
do wrong
and
things.
years.
And when when that happens to your family, the way that you interface with the health landscape is going to be one of skepticism, cynicism, and stay away from them.
Right.
We have to go back out there and say that did happen. First of all, acknowledge that it happened.
Right.
That happened, but I didn't go to medical school and spend $250,000 to do that to you.
Right.
Especially
And
not
we,
me. Like,
but you know, and I'm going to tell you. I mean, it's us wanting to evolve.
we have to.
I'm going to tell you. So in my family, there's a big distrust of the Jewish community in my family. Very interestingly, and the reason is because my grandfather, my grandmother were married. They had 10 children. It was 12 children, 10 girls and 2 boys.
Yeah.
Right, and they bought a home. Okay, they were not like on a estate or anything. He worked. He was construction, and she was a stay-at-home mom. And he bought a home. And he bought a home from a Jewish guy, and they paid every month until it was paid. It was paid. Well, come to find out, the Jewish guy died, and when he died, I guess his accountant came over. Whatever ended up happening, they learned that they had purchased the home 3 times.
He had been paying.
He had been
3
paying,
times
and
over.
they purchased the home 3 times. It had already been purchased, and he was continuing to take money and take money. And so from that, and that was their lack of education. Nobody was counting. We didn't know how much we paid for the house. We didn't know how much we were paying every month. It was a lack of education and assuming white was right. And so they're not going to do me any harm. And so it became this person who happened to be Jewish did something distrustful. So the whole family was actually geared, guided, and educated, never trust a Jewish person. And so for me, that had to change, because in going to school in a mixed environment, some of my closest friends were Jewish.
Yeah.
But then it was like, my mom would be like, what's her last name?
Oh my.
And then it'd be like, well, you know, you can be friends with her, but you can't trust her.
Yeah.
And
that
understand
passed down. Yeah.
So in dealing with those traumas, to say no, there's good people in every race and there's bad people in every race, and truly having to adopt that, and me actually having to embed that in a parent. So I think we're in a space with, as being African Americans, we literally have to then revert back to the elders, to the OGs sometime, and be like, hey, let's talk about this.
No, absolutely. But I love your approach, because what your approach does is it acknowledges it. And then, you know, this idea of, hey, listen, you don't have to take that test. Your ego is completely detached, because you know that there's something going on. You allow that person then to uncover what's in there and look at it objectively. So really, that is the responsibility of each individual. Let me look at what the thoughts and ideas that I hold so true, and let me just see if there's a reason for me to continue that. Is there a reason for me to think differently about it? That's each individual's responsibility. Our responsibility as physicians, whether you were there or not, whether you did anything to anybody or not, is to go out and regain
the trust
of the people whom you went and dedicated your life to help them end human suffering.
And that's being open, that's being honest, that's being transparent. Now, you might not like what I say.
That's right.
And let's see if we can come to some common ground.
Right.
But I'm going to tell you the truth.
That's right.
And that is how you regain the trust.
And it's a must, because as we move into this next phase of life where
Lord have mercy.
AI, machine learning, deep learning is going to be a part, you still have to be healthy. And no matter how much it can help you tie your shoes and write your taxes, you still have to have a body that functions. So as long as the human body is like this, it's got to be
see
healthy.
one of us.
So we really do have a lot of work to do. And I just believe that for men, it does go into a different category, because many men, the last time that they went to a doctor, not all, because I think we don't get enough credit for going, but many men who don't go to doctors regularly, the last time they went to a doctor, their mother took them to the doctor, the pediatrician, for a pre-participation physical to play basketball, baseball, football, whatever it is. When you go to that, it's a pediatrician. When you go to that visit, I remember them distinctly. There are a couple things that they're doing. One of them is to check for indirect hernias. And in order for you to get that test, they have to have your testicles in their hand. And they go into the little fossa area, whatever that little inguinal fossa, with a finger, and ask you to cough on both sides. Whether you want them to do it or not, you didn't get a chance to say, I don't want him or her to touch me because the last time they did it, it felt a little bit extra. When you're 12, 13, 14, mom is not in the room with you anymore. And I'm not saying this is the reason for all of it, but just the fact that I don't have agency. Now, let me just ask you a question. What respectable man is going to offer up his agency just walking in the door? So he'll have in the back of his subconscious mind the fact that doctor equals relinquishing my agency. Control.
Yeah.
I am not ever doing that.
Yeah.
Especially not as a man. And listen, I'm a businessman. I have this.
Yeah.
You're not about to do that.
Yeah.
So this is the responsibility of the individual to say, let me do a little bit of soul searching. Sometimes therapy is the way to go. And see if that's in there. Because you can't let a pediatric experience kill you. Because that's what it was. A testicular exam when you were 12 kills you. Think about the indirect connection. Because if you don't go to the doctor and your blood pressure is high, and it's 160/100, you leave it there, you do not live long, period.
That's true.
If you allow yourself to gain weight and then your blood sugar gets out of control and you just let it keep getting out of control, you do not live long.
That's true. That's
okay?
true.
So now, you see how that responsibility is so important.
Yeah.
So anyway, that's heavy.
I mean,
that's
but
what it is.
I'm going to tell you, like I said, the one thing that I will always try and do, Doc, is compromise. I try to compromise.
Yeah.
So, because I get a lot of these women, one of my things is, when's the last time you saw his STD test? And no, saw it with your own eyes. When's the last time you saw
her partner?
Her partner.
Yes. Good.
And then they're like, I don't know, a couple years. And I just say, why? And I'm always like, this is a safe place. There is no right or wrong answer. No matter what you answer, I'm going to take you down the street. I want you to go down anyway. So let's just talk. Right. So why? I don't know. And I'm listening for the trust thing so I can break that all down, because testing ain't about trust. So let me just break that down. Testing ain't about trust.
Ain't about trust.
Ain't about trust.
Ooh, that's sweet.
So I'm waiting. Why? And I keep asking why. And so finally, I don't know. I guess I just trust them. Okay, that's what I was waiting for. But, I'm like, well, when's he seen a urologist? I'm like, you 42. I'm sure he's in his 40s. He got a whole appendage hanging from his body. Right. He don't need to see a specialist. Right. He don't need to go get that checked out. What if it's an infection in his balls somewhere? Right. What if it's like, it doesn't have to be an STD. Yeah. When is the last time he was checked? Right. Well, I don't know. So he don't want to, and I'm gonna have my theory on why they don't want to too. And we're gonna talk about that. And I wanna know how you feel about that. So I always tell him, I said, okay, here's this. If he doesn't wanna go, he doesn't wanna get his prostate checked, tell him he can get a blood test called a PSA. We can skip the prostate if the PSA is normal. Mm-hmm. If the PSA is abnormal, all bets are off. He got something going on. He got to get a finger wherever they put a finger. Right. But here's my thought. And I wonder how you feel about this, because I had this conversation with the patient before. I think males sometimes are uncomfortable going for prostate exams because they feel good. Now, granted, if you stop and think about, before you get the finger past let's get past all that. Let's get past the finger in the booty situation. Prostate massage feels good. So
yeah, but you got to get past it.
Yeah, I mean,
that's a big jump. Oh, forget about the entrance. We're talking about 1.5 inches in, but no, forget about that.
But I mean, if you stop and think about it, I'm like, well, is that some people's thing?
I'm stopping to think about it a lot.
You like, no, player. But I'm just saying, and does that then test your manhood? Because now you're having something done that you should be very much opposed to mentally, but you're like, this ain't so bad because I kind of like the way it feels. Right. So what are your thoughts on that? Because I don't have to have it done.
Well, no. So that's not that feasible. Now, listen, just because It's the entrance that's the whole, because first of all, it's painful.
Okay.
If it is not a place that is being used to having that,
On the regular
it's
stuff,
not
it's
for
painful.
anybody. I mean, you know, it's
For a
just,
finger.
yeah, but okay. So think about historically, most of the primary care doctors were men.
Okay.
What's the size of a finger relative to the, you know?
Yeah, that's true.
So let's do a quick commercial break. Nobody should be going straight for a digital rectal exam. You should be doing the PSA because the digital rectal exam is not that good.
Okay, so and I like that because a lot of them think just automatically you
If
go
they're
to your
still-
doctor and they gonna stick a finger in there. So
And
you're
there are
saying they
doctors
shouldn't
that
be
are
doing
still
it.
doing it.
Yes, but they
that
shouldn't
doctor has not been up to speed, or maybe that doctor just likes doing it.
be. Oh, okay.
No, see, I mean, let's
keep it 100
we're still,
now.
We're human.
Yeah.
But if the doctor has kept up with the guidelines say don't lead with the digital rectal exam.
Look at God.
The digital rectal exam is misleading, and if you don't do the PSA, you can miss anterior cancers. Because
Look at
the
God.
back of the prostate is
what you're touching.
Is what you're touching.
Right.
The front of the prostate is where or in the middle of the prostate is where many of the things start in the first place. So you're not going to feel a nodule. And then we had Courtney Hollowell, who's a urologist, runs a department in Chicago, says by the time you feel a nodule on a prostate, it's too late. The thing is there.
Dang.
So the PSA is more sensitive. That means it's not going to tell you, nothing.
What it is, but it's gonna tell you something's going down.
If something's going wrong,
Early.
let's just put it that way. Sensitivity is a real word that we use. If it's a sensitive test, it's not going to give you a false positive or a false negative. Okay. And it'll find the little tiny ones that you can't feel anyway. Okay, so PSA is a
So I'm
blood
out
test.
here giving good advice and don't even know it.
Fantastic advice. See?
Look at
that sticks with the theme. That's the through line here.
That's-
Dr.
hey.
After dark.
Wow.
So it's the PSA. So I will tell all men and the women who love them, take him in there and get that PSA.
Get that PSA.
And I have a little thing. If you go to my my Instagram page for the podcast, I got a little blurb on there about prostate and the 5 things I want men to do. One of them is get that PSA and some cutoff. So with that being said, it's not feasible to go back to your scenario that it feels that great because first of all, they're not in there that long. I mean, if they're in there and they're like, whoa, boy, and you look and you're like, what is it? The hell? 2 minutes? I mean, because your hands are right there. I mean, you
Something's
kind of
wrong.
been, like, why are we still working with this?
Something's
Both
up.
of y'all are having a great time. No, I'm kidding. But no. Okay, I hope my wife doesn't see this. But no, seriously. But that's not feasible. I just think it's the societal piece for a heterosexual male. Got it. But it's not fun. It don't feel good. That's why we don't want it.
Gotcha. Okay.
Yeah.
All right.
But
I love
I
that.
didn't see the cuffing thing y'all did. That's a different story.
Yeah, that's
But that's also a smaller finger.
mm-hmm.
Okay.
And a different situation.
Different situation. Psychologically.
Well, that's a whole different.
They
group.
should go to your episode. What episode was that on?
The cuffing.
Yeah.
I think that was like the first episode, the first one back.
Yeah.
When we came back in 2024.
It sure was.
It was the first one back. Yep.
Yeah, let's get some more views on that one. Y'all. Hit that one up. No, okay.
It's really interesting with that one. But all right, Doc. So tell the people where they can find you, your Instagram. Tell them about your podcast, everything.
Yeah, no, the podcast, I'm really excited about our podcast, and especially what we have coming up. It's the Health Mastery Cafe. You can find it at the Health Mastery Cafe on Instagram, Health Mastery Cafe on Facebook. Find us there. Should I do that again? Yeah, okay. I'm listening to the directors. See, you can't take me nowhere.
I love it.
So you can find me at the Health Mastery Cafe on Instagram, Facebook, and on YouTube. That's where our podcast lives. And it's about health, wellness, and mindset topics. And we do it in a casual setting, much like this, to an expanded audience. We want everybody to look at it because, one of the things that I love about having the opportunity to take care of people is that it feels good. So I want to do it all the time. I want to help people all the time. And that's what we're doing on the Health Mastery Cafe. My clinic is the Prevent Clinic, and that's in Sandy Springs. And you can find us at Prevent Clinic on Instagram. Let's connect. Let's talk. So.
Yeah, thanks, Doc. Thanks
Yeah.
for coming on, Doc. It's amazing. Love to sit and talk to him.
Yeah.
I know, y'all, I don't know where y'all are from or where y'all city is, but it's difficult to find, a couple of black doctors who are fly and in their zone and handling their business. So I appreciate you guys for joining. I hope you learned something. I learned something today, so I know y'all learned something. And thank you so much for joining. And until next time, Dr. Tasha After Dark.